Taking on superbugs, an introduction to antibiotic resistance. The scientific developments of the 19th century were crucial for the medical revolutions of the 20th century. Louis Pasteur's and Robert Koch's work on germ theory was one such development. Germ theory looked at the role of microorganisms such as bacteria, viruses, parasites, and fungi in causing disease. Today we will go into more detail about the relationship between bacteria and disease. Understanding the relationship between bacteria and disease development was instrumental in the creation of antibiotics and antibacterials, which are chemical compounds used in the treatment and prevention of bacterial infections. They act by either killing the disease-causing bacteria or inhibiting their growth. The drug salvarsan was the first antibiotic created in 1910 to help treat patients with syphilis. In 1928, researchers developed penicillin, which is referred to as the hallmark of drug discovery and was an important stepping stone in antibiotic research. Following the discovery of penicillin, antibiotic research boomed, with the majority of drug discovery occurring by 1960. We owe our increases in lifespan and reductions in disease incidence to antibiotics. They have been the hallmark of modern medicine and one of the key players for the treatment of life-threatening diseases. But recently, the effectiveness of modern medicine is being threatened due to the consequences of antibiotic misuse and overuse. When an individual develops a bacterial infection, there is a chance that within the infectious bacteria, there will be some that are naturally resistant to certain antibiotics due to genetic mutations. When the individual is treated with antibiotics, there will be some bacteria that survive in the presence of that antibiotic. These resistant bacteria are then able to multiply by billions and pass their genetic material to neighboring bacteria. This transfer of genetic material makes more of the bacteria resistant to that antibiotic, which renders the drug ineffective and enables the infection to persist. These bacteria are referred to as antibiotic resistant. One of the most notorious strains of antibiotic-resistant bacteria, or superbug, is Staphylococcus aureus, which is typically targeted by penicillin. Unfortunately, a group of these bacteria have mutated in such a way that they have become resistant to all antibiotics belonging to the penicillin class, including methicillin. As a result, these bacteria are called methicillin-resistant Staphylococcus aureus, or MRSA. Drug-resistant bacteria are typically classified into either of three threat levels: urgent, serious, and concerning. Urgent threats demand immediate attention to help stabilize the patient and limit transmission and serious threats. For an example, MRSA can become urgent without monitoring and prevention strategies. Researchers are having difficulty developing drugs to keep up with the rise of drug-resistant bacteria. In response to antibiotic resistance, modern drug discovery has become increasingly target-centered, meaning that researchers are trying to synthesize molecules that will target specific components or processes of bacteria to eradicate a particular disease. Such targets include cell walls, proteins, DNA replication, and RNA synthesis. In fact, there are currently 303 essential bacterial gene targets for which antibiotics are being developed. The Brown Lab at McMaster University has been central to the understanding of bacterial gene targets, since the lab's research has demonstrated that if bacteria are grown in low nutrient conditions, there are many more genes, 422 to be exact, which can be targeted. While novel research like that being conducted in the Brown Lab provides incentives for the pharmaceutical industry to invest in antibiotics research, there are many ways the public can help in the battle against antibiotic resistance. Taking antibiotics responsibly and not prescribing them for non-bacterial infections can go a long way in preventing drug resistance. We need to remember that the more we use antibiotics, the more resistance is seen in the clinic and the less successful we will be in combating disease. For more videos, please like, comment, and subscribe to the McMaster Demystifying Medicine series channel.